to everyone. We welcome Dr. Abby Goldstein with us this afternoon. Thank you for being with us.
You're welcome. I'm glad to be here.
Dr. Abby Goldstein is a clinical psychologist, associate professor of clinical and counseling psychology at the Ontario Institute of Studies in Education at the University of Toronto, and Canada Research Chair in the Psychology of Emerging Adulthood. And as well, we're lucky that Dr. Goldstein is part of our advisory council at Drug Free Kids Canada. So it's an honor to have you here today. Thank you for being here.
You're welcome.
So we wanted to talk today about substance use by kids, and we know that you have a lot of expertise in that sphere. We want to share some practical tools with our parents, and we really want to provide information that they can use to have informed conversation with their kids. So let me start by the first question. Is there any links between mental health issues and substance use by kids? I know that parents out there are concerned in the current context of a pandemic and, kids being a little bit more isolated and maybe feeling stress and anxiety going back to school in an uncertain context. So can you maybe elaborate on the correlation between mental health and substance use?
Sure. Yeah, I mean, absolutely, substance use and mental health issues are related to each other. We know two things. We know that those who have a mental health concern are more likely to also have a substance use concern, and it works the other way too, that those youth who have a substance use concern are also more likely to have mental health issues. I think oftentimes the question that's being asked is, does one cause the other? And I think that's the information that we don't really have sort of a lot of confidence that necessarily substance use causes mental health issues. In some cases, for example, the link between cannabis and psychosis, there is more evidence to suggest that there's a causal relationship. But for most substance use and mental health concerns, we know that there's a relationship. It's just not clear sort of what the exact pathway is, but certainly they are related, so that if we know that there is a youth struggling with a mental health concern, we certainly would want to be kind of observing and making sure we're aware of substance use possibly being an issue. And it works the other way too. When substance use is a concern, then we also want to understand better what may be some of the mental health concerns that are also on board for that youth.
Okay, interesting. Thank you. Do you know if alcohol and cannabis use by youth has increased, specifically maybe in the context of the pandemic, or generally speaking, and why would that be in this current context?
Yeah, it's a very good question. And I'm very sure that many researchers are sort of on that topic right now, trying to learn more about whether or not we're going to see increases in either, substance use, alcohol, cannabis use, especially since those are the substances most oftentimes used by youth. There was some research done by Statistics Canada where they simply asked people, did their cannabis use increase, and has it increased since the pandemic? And in fact, there was some evidence to say, especially among young people, so those between the ages of 15 and 34, that there were reports of increases in cannabis use in particular during this time. So just with that one question, it seems that that's a possibility. It's just we haven't had enough time to really look at whether or not the rates have increased over the course of the pandemic. But I think what you raise is a really important point, which is that when people are experiencing more stress, then they're looking for ways to cope with that stress. And substances oftentimes are ways that people do cope with stress. And when we think about youth in particular, they may be turning to substances perhaps more, in an attempt to cope with some of the feelings you talked about, feeling anxious or the uncertainty or isolation. And so I think we, again, really want to be monitoring and aware of what's happening with youth to make sure that if we are seeing increasing rates, that we're working on prevention and intervention to help with, managing some of that as if it's evolving that way.
Okay, so we have parents, I'm sure, watching right now thinking, okay, so what should I be looking for, right? So if all of a sudden I'm starting to have doubts that maybe my kid is starting to use or is experiencing stress and maybe turning to substances or wanting to experiment with substances to manage the stress, are there specific signs or risk factors that would maybe make a teen more susceptible to turn to substances to cope with those feelings?
Yeah, I mean, I think we already sort of touched on one of the risk factors, which is that there are mental health concerns already on board. And so that is one of the risk factors for the development of a substance use issue. I think in terms of what we look for, I mean, it can be very hard to tell because a lot of things could look like a substance use concern, but may in fact be other things. But if you find that there is a significant change in your child's behavior where you notice that they're doing things that they haven't really been doing before, or their mood seems to be more variable, so you're seeing changes in their mood that weren't obvious before, they're spending more time alone, isolated in their room, with their door closed, seem to be sort of a little bit more hiding things, so they're not as open with you about what they're doing when they're spending time when you're not with them. Those may be causes for concern. And I think there's certainly cues that would say it's important to ask some questions and express that concern so that a conversation can be started.
I think you have a good point. I think that, it's hard sometimes to find that right balance of saying it's just teenage years and they're growing in autonomy. But when is there time for me to be a little bit more concerned about that? And you're raising the good point of saying, well, maybe I should talk to my kid about it and share my concerns and see if they're going to validate my concerns, or just knowing that this is the normal passages of teenage years. But how would you say, so engaging in conversations, if I take that further, how can parents intervene in an effective way? Like, what positive steps can they take to either share their concerns or, approach their kids to be able to have that discussion?
Yeah, and I think actually that the kind of framing it under sharing concerns is such an important way to frame it, because it never wants to feel like an accusation or sort of somehow blaming or even making a suggestion of something that really kind of isn't capturing what's happening. I think when we're raising concern, doing so in a way that is non-judgmental and that is non-confrontational is really the most important part. You really want to make sure you're opening a dialogue and that it allows the dialogue to continue and doesn't shut things down very early on. So even if you've noticed a change in your child's behavior, you may want to approach it just that way, just to say, I've noticed you've been spending a lot more time in your room than usual, and I'm concerned I'm missing our time together. I'm just wondering if there's anything going on or if there are some things that you want to talk about. And I think we always want to leave it as, the door is always open. If there is something, I want you to know that I'm always here to talk to you and I'm not going to get angry. I want to be helpful and supportive. So please, if there is something that you're wanting to talk about, let's make sure we're talking about it.
Okay, so what I'm hearing is approaching it with an open mind, but from a caring perspective. I care, I've noticed this, and I'd like us to talk about it. So that's a really valid point, and it's a positive step to take towards having an engaged conversation without being confrontational. We talked about risk factor. I think I'd like to talk about protective factors. Are there anything that as parents we can do and encourage to really build those skills so maybe kids are not going to be as prone to turn to substance use to either cope with stress and anxiety or just as experimentation? But what do we do to build those skills for kids?
Yeah, it's a good question too, because I think that really sort of spans development. So protective factors can start much earlier than the actual involvement in substance use starts. So when we think about some of those early protective factors, the bond and relationship with parents is such an important protective factor. The sort of social competence, so the extent to which a child feels that they can engage socially with their peers and feels that they can effectively socialize, that's an important protective factor. And one thing that I think is particularly important that is more oftentimes apparent in adolescence is something called parental monitoring, which is really about the extent to which parents know what their kids are doing and who they're with during unstructured times. And I think COVID raises some sort of interesting ideas around this, because there is so much more time where kids are at home. And so it may not be that parents feel the need to check in as much about what their kids are doing when they're upstairs in their room alone. But that is still a time where it is important to check in. Just because we're all under one roof doesn't necessarily mean that we all have good ideas about how everyone is spending their time. So making sure those check-ins are still happening while everyone's still in the same place is important. And then when kids are going out and they're with friends or involved in other activities, checking in, making sure you know where they are and who they're with and how they're spending their time.
That's such a valid point, that the parental monitoring, about saying, we take for granted we're together. We're in the house. I see my kids a lot more than I used to. So taking that for granted, that I know what they're doing, when if they're in their room all day, I don't have an appreciation. So checking in, even if we think that we're in close proximity, is a great point.
Yes. The other thing that I think is important, and also is both sort of on the risk and the protective sphere, is around role modeling, right? I mean, as parents, we play a big role as far as how do we model things like, how do we cope with stress? I oftentimes give the example of, parents may very well have a glass of wine when they want to relax, but the messaging around that is very important. If we sort of come home at the end of the day and say, oh, I feel so terrible, I had such a bad day, I think I'm going to have a glass of wine, that's sending the message that the best way to cope with stress is through having that glass of wine. And so that kind of messaging is really important in terms of how we deliver that to, kids and teens, because they pick up on it. And we want to make sure they understand that there are lots of different ways to cope with stress and anxiety and low mood, and that they see us as parents using those other strategies so they too learn how to cope with those difficult emotions.
So that would be one of the protective factor that you're saying, to be able to maybe explore with your kid healthy coping mechanism, right?
Yes.
So having a glass of wine is one of the option. But going for a walk, doing some exercise, but talking it through with your kid and finding ideas, I think, as you're mentioning, could be a really good protective factor.
Exactly. Yes. And we've heard a lot about that even from, families during COVID, which is that there's a lot more time being spent together as families doing things like cooking together or going for a walk. And I think that's really coming across as how we're coping with what is a stressful time, is that we're doing these things that help us spend more time together and also are just good stress relievers.
Mm-hmm, mm-hmm. We often get asked, so we're providing a lot of useful information for parents to engage in conversations, but we often get asked, when should I start? What about, age-appropriate conversation? Is it okay for me to start talking about cannabis to my kid who's still in primary school? Like, how early should I start? And what does it look like to have age-appropriate conversations around substance use by youth?
Yeah, I mean, I think, in many ways, we want to take cues from our kids. So we don't want to shut down conversations, no matter what age they're coming up. So it may be that a younger child, a 7 or 8-year-old is hearing, ads on the radio around cannabis. I remember with legalization of cannabis, there was lots of talk in the news about it. And so kids were naturally curious, what's this about and what does it actually mean? And so we want to use those cues to open up conversations that we can have about substances. But yeah, the age appropriate piece is important. And younger kids generally think in sort of all or nothing terms. They tend to see substance use as usually, either good or bad, but mostly bad. Oftentimes you'll hear kids say things like, I'm never going to drink. I never want to have those, I never want to do that. I never want to touch a cigarette. They really see those things as sort of in the category of things they do not want to do. And I think it's okay, especially at those ages, to emphasize the kind of consequences that may be associated with those substances. But as kids get older, they're thinking about those things change. And we want to be aware of that too. We want to recognize, just because a child at 8 said they're never going to touch a drink of alcohol, doesn't mean that at 15, they're going to have the same thinking about it. Mm-hmm. And so continuing to have those conversations throughout the span of childhood and adolescence, and also knowing that the nature of those conversations is going to change. So as kids get older and there is likely to be more experimenting with substances, focusing more on harm reduction. So recognizing that what's really important, again, is that kids know that you are a safe place for them to have these conversations, and that if they're struggling or if they have concerns, that they can have an open conversation with you about them. And so talking about things in a harm reduction perspective, for example, talking about, what would you do if you were with a friend and they had had too much alcohol, knowing that they can call you no matter what and that you're not going to get angry. Those are the kinds of conversations you want to have, being open to the idea that experimenting is likely to happen and you want to be minimizing risk as much as possible.
So not approaching the matter by being alarmed and saying, oh my God, but being able to talk it through. What about in a family where you have a younger kid who has an older sibling who is using or maybe having problem with substance use? What's the appropriate thing to do by approaching this younger kid? Like, what would be an appropriate thing to talk about with that kid in that context?
Yeah, I think you'd want the sort of the focus to be on understanding what the child who's sort of observing these things, what is it that they are thinking about it, what is it that they are concerned about, and helping to provide reassurance around those concerns. So I think, again, it's not necessarily that the child may be aware that it's related to substances. They may just see that there's unusual behavior or behavior that they're not used to seeing in their sibling, and so making sure that they feel reassured that they are safe and that there's conversations ongoing about this, so that they don't feel like they're in a position that to be uncomfortable or that things are unstable for them. Again, it may not be important to talk about substance use specifically in that instance because there may not be awareness that that is the issue, but to talk in general about what happens when there are challenges and when there are stresses to be dealt with, and how as a family do we come together and manage those things.
So I guess we're coming in full circle about, correlating mental health and substance use. So being able to talk about those things that may affect us, and not necessarily engage in talking about substances specifically, but, talking about healthy ways of approaching struggles in your life. And then after that, if you plant that seed, then as the child grows older, I guess that it's going to be easier to be able to engage in those conversations and not as intimidating when later on. You work with kids, Abby, and we're curious to find kids that are starting to use substance use on a more regular basis. Do you have any insight as to why they start, and in the spirit again of being conscious as a parent and aware of those signs? What kind of information are they providing to you as to why they are turning to substances and starting to experiment?
Okay. It's a very good question. I mean, and my work is really with teens. I think one of the things that we see is that there is, a fairly consistent path, which is most kids and teens start with experimenting. I mean, that's really the initial entryway into substance use, is that oftentimes it's just experimenting with substances and not necessarily use in a way that may be causing problems. But there are sort of some subsets of teens who may go on to use substances differently, more often, and in ways that cause them consequences. And some of the factors are related to all of the things we talked about. I mean, I think oftentimes it is that there is an underlying mental health issue. Either, it may be depression, it may be anxiety. And so the teen sort of discovers through that initial experimenting that in fact using substances is a way to cope with some of those difficulties. A good example may be something like social anxiety. So if you have a teen who generally feels uncomfortable in social situations and they experiment with alcohol and notice that it reduces their anxiety in that social situation, it may be the case that that teen then starts to use alcohol more and more often in social situations. Mm-hmm. It has the effect of reducing their anxiety in that situation. And yet there are, it's in many ways, it's sort of counterproductive, because in fact, some of the after effects of alcohol is that it actually increases anxiety. Mm-hmm. And we also know alcohol is a depressant, so it can induce sort of some depressed mood as well. The piece that's important, though, is that it is most often the case that there are other underlying factors that really need to be attended to. So it's not just that there may be escalating substance use, but oftentimes there are some underlying concerns that really need to be discussed in addition to talking about substance use. So looking more closely at anxiety or depression or struggles that the child may be having with friends or in school, oftentimes those are the factors that contribute to escalating substance use and really need to be addressed as far as really getting a handle on how can we help this youth to reduce their overall substance use.
So how would parents know, when is it time to ask a professional to join the conversation, right? So you're doing everything that you can and you're engaging in those conversations, but when is the turning point where you think that parents need to turn to a professional for support?
Honestly, I think it's probably, never really too early to do that. If you have a concern about your child and you feel that their behavior or their mood is really different for them, you're noticing a change in those things, it is a good idea to consult with a professional. So that, in many cases that starts with your pediatrician or your family doctor to have a conversation about what you're noticing and then to see where it goes from there. So I think as parents are feeling those concerns, that having that conversation with a professional can help them both in terms of either, having some way to reassure them about their concerns, or the other way, which is to get some advice about what are the next steps, what should they do next, so that they don't feel alone as far as helping to support their teen.
Okay, well, thank you. That's all the questions I have today. Do you have any parting words for our parents right now with their kids going back to school and for them to engage in positive conversation with their kids?
I think the biggest message is really about sort of having these conversations often and using what I call teachable moments. So if you are seeing, an ad on TV or you hear a story on the news, those are great opportunities to be able to open the door to have a conversation, to just ask, what do you think about that issue? An example I see is there are lots of cannabis stores starting to open in various neighborhoods. And I think that's a great opportunity to start to have conversations with young people about cannabis and understanding what the risks are. And so really taking advantage of those teachable moments and not waiting until it becomes a concern before those conversations happen.
Dr. Abby Goldstein, thank you so much. I'm sure parents will benefit from our talk today. So thank you for your time.
You're welcome.